I have patients that come in all the time asking me, why are dental implants supposed to be the best and the latest and greatest? And they've been around for a long time. It's just now that they've come into the mainstream where there's just so much easier to place, to predict, and to get the results that we want. Implants, I would say, are the best way to replace single missing or multiple missing teeth. It's an easier way to get something in your mouth that's going to stay in place and not have to be removed. Implants are a wonderful way to replace teeth, but they need to be taken care of properly if they're going to last you a lifetime. The most important thing with any type of restoration is how to take care of it. If patients don't maintain it, what makes them think it's going to last? If their original tooth didn't seem to work or last, what makes what I placed there any better? Okay. Implants, if they're taken care of properly with home care and with their dentist and with me, it's going to be a much better, more predictable, longer-term outcome. And we can actually increase the longevity of teeth by many, many years with that. My job is always to save teeth. But there's some times where teeth just can't be saved, whether it be because they're cracked, fractured, abscessed, or just aesthetically not pleasing, and someone wants them removed and replaced with a better alternative. And that's where implants step in.